Excited beneficiaries of the National Prescription Drug Plan turned out bright and early Tuesday morning at the National Insurance Board's Blue Hill Road headquarters as distribution of ACE RX membership cards commenced.
The ACE prescription card is a trademark of the National Prescription Drug Plan, and ACE stands for Access, Choice and Equity, and essentially means that we're providing increased access for persons suffering from one or more of the diseases identified in the first phase of the plan. Choice in that they now have a choice to go to either private or public pharmacy. We want to ensure equity in order to ensure that persons can now manage and treat their diseases better. So ACE really is a trademark of the National Prescription Drug Plan, and it means that we are providing the tools to beneficiaries of the plan to now manage their own conditions.
Beneficiaries were greeted by Minister of Health, the Honourable Dr. Hubert Minnis, who said the National Prescription Drug Plan had reached an important milestone.
This means that we are very, very close to individuals going into the private sector, the pharmacies in their given areas to collect their medication, and they don't have to wait on any line at Princess Margaret Hospital. They can go anywhere and do that. Lots of people would have had doubt whether it's a reality or not, but now we've proven that it can work, and we're waiting to move into the second stage where the 100,000 individuals would likewise be a part of this health reform that we're introducing.
The minister also presented the very first ACE RX card to Sister Mary Benedict, who was the first person to register for benefits under the plan.
I feel very excited about it because I think it's time that something will be done for our people here in the Bahamas, and so I'm glad I'm here today to receive my card, thanks to National Insurance.
Other approved beneficiaries also commented.
Very excited. I'm so happy that I don't have to spend all of that money every month for medication.
We needed this anyhow, because medicine and stuff is very, very expensive, so it's a good help for us, you see.
Very relieved actually, because medicine is very costly, and many times you couldn't get it at the Princess Margaret, and you go to the outside pharmacy, and those are very expensive.
Although card distribution has started in Nassau and will begin Thursday in Grand Bahama and the Family Islands, Algernon Cargill, Director of National Insurance, said benefits will not be accessible until sometime later this month.
The card will not be able to be used until we officially launch the plan. And the plan is scheduled to be launched later this month. So what we're doing first is to ensure that the cards are distributed to all of the beneficiaries of the plan that have been approved. And the second phase will be for us to officially launch the plan. And within the next 2 to 3 weeks, during the month of August, we will launch the plan. And then the beneficiaries will be able to go to any of the participating private or public pharmacies in order to obtain their medication at no cost with a valid prescription from a doctor.
Mr. Cargill also said in some instances, cards may not be available because physicians have not yet executed the required paperwork.
Well, most of the cards will be ready today. Obviously, the primary delay would have been because the doctor has not yet signed the application. And part of the process calls for the National Insurance Board providing the application to the physician to actually certify that the patient has the chronic disease. After that process is done, then we have the cards manufactured, and the cards will be manufactured overseas. But it doesn't mean it's going to take any longer. The cards have been manufactured, and through the technology that exists, we can have cards here within a couple of days. But primarily, the biggest challenge we've had is that some of the physicians have not signed the forms. And we've had a lot of cooperation from the public pharmacies, as well as the public doctors, rather, and some of the delays we've had have been with the private physicians. So we want to use this opportunity and encourage all the private physicians that may be holding up on the applications to please provide them to the National Insurance Board as soon as possible, because we are unable to provide the beneficiaries with their ACE card until the physician has certified that the patient has the chronic disease.
For more information on card collection and registration, visit nibdrugplan.com or call the Drug Plan office at 356-2070.